Hello, my dear friends. Namaste and welcome in our PMC channel. I'm your host Kavita, and today we are going to start a wonderful series on health. So, friends, are you happy and healthy? If you're happy, are you really healthy? Are you working on your lifestyle? Are you having a good diet? So, we have one known personality, Dr. Surya Sai Akhil, who started his physiotherapy journey 7 years back, and he's one of the known person in Hyderabad. So I know you have a lot of physical challenges and you must be visiting doctors because after certain time it is not possible that we can, bypass it. Before that, let's know more about Dr. Surya Sai Akhil. He's a senior consultant at Dr. Akhil's Physiotherapy. Friends, don't go anywhere. Please be with us and watch this episode till end. You may get lot of your answers from my questions. Dr. Akhil, welcome.
Thank you.
How are you doing?
I'm doing good. How are you?
I'm doing absolutely good. So, Dr. Akhil, what is physiotherapy first?
So, coming to the physiotherapy. So, physiotherapy is like dealing with the multidisciplinary injuries
Mm-hmm.
or multidisciplinary team. So, physiotherapy alone is not a big thing to deal with this. Sometimes what will happen, people comes directly with us and we will deal with them after the consultation
Right.
by assessing the problem. Second thing, surgeons will refer the patient after the surgery or before the surgery. We called it as preoperative and postoperative. Preoperative is conservative management. So coming to preoperative is conservative management is something like if you have a ligament injuries, if you have a back pain, if you have a neck pain, or if you are having shoulder pain. So these all are like interrelated sometimes individual way.
Right.
So we have to understand what kind of injury it is, what kind of problem you are facing in your daily life.
Right. So it can take like a lot of time. If we
Yes.
say
Yes.
neck pain,
Hmm. Hmm.
shoulder pain,
Hmm.
spondylitis,
Hmm.
back
Hmm.
pain. So
Yes.
all these things doesn't happen in a single day or a
Yes.
month.
True.
It takes long time.
Yes.
Right.
Actually, we can divide it into three phases.
Mm-hmm.
So any problem, acute phase. Acute phase is like which affected now immediately, and it will be stable for 1 week. Like
Right.
it will stay within you.
Correct.
And in this 1 week you can able to perform the activity, but you will have some discomfort or pain. If you are avoiding it and you are continuing with your activities or with your daily life, then it will lead to the moderate. If
So
you are still neglecting, then it leads to the chronic. If suppose from acute to chronic, for few people it will take months, few people take years. If it is dealing very fast, drastically it is increasing, or drastically it is damaging,
mm-hmm.
that means your health is also suffering with multiple issues.
Right.
It may be because of malnutrition or insufficiency of the nutrients in your body, or insufficiency of the vitamins and minerals in your body. So these all are interlinked.
Right.
So we have to understand because of which he is affecting more.
So if it goes to chronic level, the other problems may get also increase. Maybe
Yes.
because you said that these are interlinked. So due to one problem, other problem you may face.
I will tell you one example.
Yeah.
You said cervical spondylitis. Cervical spondylitis is related to the neck pain.
Right.
Okay. It has 7 bones. Anywhere in these 7 bones, it may compress at different levels.
Mm-hmm.
We call it as cervical C7 bones. So from C1 to C7.
Right.
So in between this, there is a disc. If anywhere it is getting compressed, the nerve will get poked, because the nerve and the spinal cords goes behind your spine.
Correct.
So this spinal cord will be impinged by your discs, because every bone, I have 7 bones. I said 7 bones. In these 7 bones, there are discs. We called it as intervertebral discs, because we call it as vertebra. It stays in between. So it is an intervertebral discs.
Right.
So this consists of a fluid. So when we are pressuring on it so much, this whatever the fluid is there, it will come out from the disc and it will get touching the nerves. When something is getting touched to the nerves are is a very sensitive part.
Right.
Obviously it will get irritated. So if it is affecting on the left side, your whole left arm will get also affected, which is interlinked to your shoulder, elbow and wrist and hand now. Because of that nerve is interlinked.
Correct, correct.
So here this may affect like this. If suppose any road traffic accident happen, then there is a chances of brachial plexus injury, where these 7 nerves will get disconnected because of the injury, because of the force.
Okay, so because of injury, these nerves will get disconnected. Oh my God.
And this hand will become completely paralyzed. So what they will do, they have to reconstruct it. There are only few surgeons in the India and only one institute in India, that is in Chennai, which will be doing this kind of surgeries in whole India.
Okay.
So these are very minute structures and these are very complicated structures to deal. We call them as a microsurgeons. So microsurgeons are like wrist hand microsurgeons, we call them. So they will operate these things. After the operating them, again they will come to us. See, the nerves are damaged. They are not reconstructing the same nerves. They will take the alternative nerves where compensate them.
Okay, okay.
They will reconstruct it. Now the task is for the physiotherapist. It completely lost its nature. It doesn't have any sensations. It doesn't have any motor function. He cannot able to perform any movement. And you know, the nerve to grow back, it's very time taking. 1 year to grow a nerve or to see the result of the movement.
Is it possible at any age?
Any age, yes.
Okay, so nerve will grow at any age, but
Nerve
it
will
will
grow
take
at
time.
any age, but there are few things. They should not be using alcohol. They should not use smoking, addicted, or they should not do any drugs in taking. Okay. Other than this, they have to do daily meditation, pranayamam, as well as the physiotherapy exercises with the physiotherapy stimulation. These all things are there where they have to do this every time. In a day, at least 3 to 4 times they have to do. 3 to 4 times. Then we can see the possible positive results.
So how do you take decision in the case of drug addicted people?
These drug addicted, we have the psychologists who will counsel them.
Right.
As a physiotherapist, we will train them physically active, because when you are physically strong, you will become mentally strong. So when you are become mentally strong, you will become physically also strong. Both are interlinked.
Correct.
If a person is mentally strong, physically weak, they cannot perform all the activities. In the same way, if they are physically strong, mentally weak, that is also not going to help him. So it's like it's both should be going in a coordinated way.
And first of all, they should accept these conditions. They should accept all these things. Correct.
So coming to our physiotherapy, we deal with the different conditions. As I said you, we will divide them.
Right.
We will divide it into orthopedics, neuro, sports, cardiopulmonary, and hand and manual therapy. And I am saying all these are specializations where we can concentrate. See, my specialization is into ortho and sports, musculoskeletal and sports. So I can deal with the sports people as well as the clinical conditions.
Right.
Same way neuro will be there, pediatrics is there, community rehabilitation is there, and I think 10 or 11, 12 specializations are there.
So you said you treat on which kind of patients first?
Mine is like mostly into ortho and sports.
Okay.
Musculoskeletal is I completely deal with the muscles, bones, ligaments, tendons, and any kind of sports injuries.
So are you comfortable to share all this treatment, like how do you treat?
Yes,
please.
yes. So as I explaining physiotherapy, all these specializations are there. So there is a lot of scopes here. We are dealing with pediatrics, we are dealing with geriatrics, we are dealing with women's health, we are dealing with the sports, ortho, neuro, cardiopulmonary. Cardio means heart, pulmonary means lungs. Where we are not doing. See, everywhere we are there, except organs. If suppose organs are affecting, if organs are affecting, the surrounding muscles are also getting affecting.
Correct.
If the muscles are getting affecting, I am there again. It may be your core, it may be your back, it may be your chest, or it may be your upper back, it may be your cervical, lumbar, thoracic, everywhere. So mostly recent times I am more concentrating on hand rehabilitation.
Okay.
See, I know previously I was with a surgeon where he is dealing with all the orthopedic related problems. He deals with the most of the surgeries related to the shoulder, knee, hip. These three complicated surgeries also he will be doing very easily. So I was having that experience with him. So I can treat this all the conditions which are complicated than what we think. We can give very best results. Okay, these are three. Other than this, I have seen all other techniques also which was performed by them. It may be elbow, it may be hand injuries or hand fractures. I think I have seen almost 10 to 15 kinds of surgeries.
Okay.
It's a different surgeries and different techniques. There are also few techniques, Elizarov techniques, in like what we call the IMN, intramedullary nailings, or platings, or hook platings, like different. So here the thing is, I understand. Okay, for this kind of fractures, they do this kind of surgery. For this kind of surgery, we have to do this kind of physiotherapy. So when you know the roots, you can treat them very fast. So that's where I get benefited. When I was with the surgeon, I was knowing the roots. Okay, this for this fracture or this kind of fractures will be dealing with this kind of surgeries, because they will discuss in front of me. If you are a surgeon, I was in your cabin, the patient came to your cabin, and you are explaining him what kind of surgery you are doing. After they leave, you will discuss with your team that what kind of surgery, what way we are doing, what is the time it will be taking, how to perform it, what are the uses. So you understanding, right? So everything in point to point you will be understanding. So if I am there at that moment, and if I am also there in the surgical theater, think how can you learn? So that's where my experience gets better.
That's wonderful. Like you got that opportunity to
I'm
learn
very
from.
lucky. I'm very lucky,
Yeah,
and I'm very much thankful to my Guruji. Like I make him my guru because of him I got this knowledge.
very true.
So that means he's a guru. So that's why I make him my guru. That, sir, without you, I'm not like this.
Very true. So, Dr. Akhil, I want to ask you one question. As you said that this pain, these things are related to any fracture or something. There are some cases like without any accident, or in such cases also people get such kind of pain, right? Maybe at late age or early age,
Yes.
knee pain or
Yes.
any sort of pain.
Yes.
So, how do you do this pain management? What is pain management?
So coming to the pain management, pain is always a sensation. See, we have a different sensations in our body. Pain is a kind of sensation. In pain, you will find different feeling. Pricking sensation, or a numbness, or a tingling. These all are types of sensations in the pain.
Correct.
Okay. So we have to understand first why he is getting pain,
Correct.
and place of pain, where he is getting pain. Okay. And what activity he is getting pain. It may be, if suppose if I am sitting idle, I am getting my back pain. That means my muscles are weak, I am stressing out my joints, that's why I am getting pain. This is one kind of example. If I am standing for a long time and I am not maintaining proper posture, or I am only keeping a weight on my single leg, for example, sometimes few people will stand for a long time,
Correct.
they will use the right leg or left leg, any one leg.
True.
Sometimes they used to stand straight. When they are shifting, because of that pressure or that workload, what will happen? The the load will be more and the stress feeling will be started. When the stress feeling starts, automatically the pain will increase. So this is the way. What we are saying, these all are stress related pains. And coming to age related pains, yes. For suppose, let me tell you, any men or women, mostly women's,
After
after
40,
30,
after 30, after
after
40.
30, 35, they will start degrading their calcium levels, vitamin D levels, minerals, everything will get slowly dragging down, because they have the menopausal stages, they have their menopause, everything, like after
Correct.
post pregnancy complications, children has to feed, getting feeding, everything. So once, before marriage, after marriage, for a woman, life is completely different,
True.
because after pregnancy she will lose a lot of things from her body, because she has to give all her nutrients to her baby in pregnancy time, after pregnancy also.
So, Dr. Akhil, as you said that women get a lot of, I mean, they lose energies or whatever.
Hmm.
So, post pregnancy or after
Hmm.
delivering a baby,
Hmm.
just by best feeding, she'll lose a lot of her energy, you said, right?
Yes, I will tell you an example.
Yeah, please.
Your like baby needs all the nutrients and supplements.
Correct.
You cannot feed him direct food when he is born.
Right.
So where he will get the nutrients? So from milk, she can't give only calcium from the milk, right?
Correct.
Only calcium does not support her. He need vitamins, he need minerals, or he or she need minerals, vitamins, all the nutrients along with the calcium. Then only the baby will get properly developed. If for suppose the pregnant woman does not have proper health or good health, then the baby cannot get the proper health, good health. If
Very
she is having that nutrients in her body, then only she can supply it to baby. Okay, if it is not there, her baby will not develop that much, and he cannot get everything what he want to make him proper healthy baby.
Right.
Okay.
These are the general case, like
Yeah, even we can see so many things, like when they born, they will born with developmental delays. Why they are borning nowadays? We are seeing more because of the sedentary lifestyle. Because of, to be honest, nowadays people will say diet. I don't know why diet is required, but they say diet, diet, diet to maintain their posture, they to maintain their structures. What I want to say, you have good organic food on time, properly, good exercise, enough. No need to cut off your calories, no need to cut off your nutrients. Have everything on time, properly, exercise, meditate. These all things you have to follow. That is called proper life. It's not like cutting down the food, not eating anything, keeping stomach empty and thinking about I have to get down my fat, I have to cut down my carbs. Does not help her or he for a long time. They have to have everything. Whatever the need of your body, you have to give supply. If you are not giving that supply, how can you expect to be healthy?
not possible.
That is where we are lacking actually. Even for the software employees, that is where they are lacking, because they eat most of the time burgers, pizzas, sandwiches, because they don't have time. They will say that only. When you're working, every person have time. Even for me as a doctor, my patients are precious to me. That's why I will not have timely food. Sometimes, if I'm doing it for the most of the times, then who is the loser? I'm the loser. I'm going to damage. If I'm getting damaged, how can my patients benefited? That's the question I have to think first.
Yeah. Yeah.
If I'm healthy, my patients are also healthy. If I'm not healthy, my patients are not so healthy.
Very true.
So I understand this little late.
Well, so you shared about this pain and pain management. How do you treat such patients?
Like see, in this pain, we treat different ways. Actually, we can divide it into 3 or 4 sectors, like electrotherapy management
Mm-hmm.
or electrotherapy. Okay, in physiotherapy, I'm saying inside the physiotherapy,
Right.
we discussed what are ortho neuro. These all are different departments.
Correct.
if we enter into the departments, again there is a different way of treatments. Ortho deals with different, neuro deals with different, cardio deals with different techniques. So different techniques. So I will tell you generalized way. Electrotherapy is one of the way to treat the pain, to stimulate the nerves, to stimulate the muscles, to recover the tendons, to recover the ligaments. We use electrotherapy. This is one way. There is one more way, we call it as manual therapy. Manual therapy, what we will do, most of the times patient will be immobilized after a surgery or before surgery if he or she get injured severely, because they has to heal. The healing time will be there. For example, if a bone get fractured, it will take 4 to 6 weeks of minimum time to get proper healing part. It's not completely. We will be understanding whether it is healing or not.
Okay.
It will take 4 to 6 weeks after a fracture.
Okay. Okay.
In this 4 to 6 weeks, if it is healing, that healing signs are there, then we will leave it in a slab or a cast. If that is not there, then it will get operated. Okay. So because of this immobilization, what will happen? Your ligaments, tendons will get stiffed, your muscles will lose its strength. So everything will drastically getting down. After this, physiotherapy will mobilize the joint. By mobilizing, along with the mobilizing, he will also improve their strength.
Okay.
So for example, there is a fracture of femur or a humerus of hand. Whatever the structures are there, like triceps, biceps, these all are muscles, shoulder muscles are there. Obviously they will become weak because of the immobilization. So we have to start mobilizing. When we start mobilizing, obviously they will feel pain because of that stiffness.
Right.
We have to reduce the stiffness first. Once we are reducing the stiffness, then we deal with the mobilization of the muscles also.
Okay.
After once we mobilize the joint, then we mobilize the muscle, then we start with the strengthening. When we start strengthening, then they will see the results. Okay, I can able to perform all my activities. Here there is a thing we have to understand. Whenever you have an injury, your mind and your muscle, that coordination, brain and muscle coordination will get reduced.
Okay.
Any kind of injury.
Okay.
The physiotherapy will always re-educate this coordination. The point has to be understood first by a patient, by the therapist, to a patient by the therapist, that they have to educate them.
So how does it happen? Like as you said that this two things.
See, it happens because your brain cells all the time it is active.
Right.
When some injuries happen, it went to trauma.
Correct. Correct.
From the trauma, it has to recover, right? I will tell you an example. You are walking on a smooth surface. There is a water. First time you didn't fall. Second time you didn't fall. Your brain cells are more active and they will say, hey, I don't fall. Every time I was walking through this line, every time I was going normal, suddenly you fall. What will happen? Psychologically, your brain will be decided that yes, because of this water, I skipped and I fall. I got injured. So fourth time, fifth time, you will be going in a same flow?
No.
No. You will be watching very carefully and you will be going very slowly.
Right.
So this is what I am saying. The brain will get into the trauma. From the trauma to recover, it will take time. It's a matter of time. It's not like it will be stable, stay there only. If something is like then we have to deal with the psychological way. We have to make them confident. We have to take them practically. We have to teach them practically. This is not going to happen again. We have to build the confidences. We have to tell the preventions, precautionary measures, everything.
Right. So slowly it will happen, but
Yeah.
it will happen definitely.
Physiotherapy always is a slow process. Physiotherapy always a slow process. We have to understand this. But that is the best process. I can assure you that. I can assure you. Like people will say that rehab is going for 6 months, rehab is going for 1 year, rehab is going for 2 years. No, that is not at all correct. Any kind of injury, it will take a limited time frame. It's a nerve injury, it's a long time.
And it may different for different people also, right?
Yeah, that's what I'm saying. Different to different people. And the thing is here, one more thing we have to understand. For example, as a for a fracture, 6 weeks of minimum time is a protocol. So most of the people get recover in that time. Most of the people. There are few exemptions. maybe because of sugar or because of thyroid or because of BP or because of alcohol consumptions or something bad habits or something like that, it will delay so much.
Okay.
That doesn't take blame on physiotherapy.
Mhm.
They are doing their self damage, so physiotherapy cannot be blamed. So they have to understand this. So I am talking in a protocol way. There is a time frame. 6 weeks, 8 weeks, 12 weeks. So within 12 weeks, most of the rehab will complete. Most of the 80% rehab protocols will be finished within 12 weeks. If there is an exemption, if there is a complication, then that will be crossed.
So if there is no other problem in body, it will cover in
It
12
in
weeks.
within 12 to 18 weeks minimum, I am saying. Minimum 6 weeks, maximum 18 weeks.
Right.
12 to 18 weeks, mostly it will be finished. If it is crossing 18, that means somewhere it is a problem. Somewhere they are lacking, somewhere they are not doing it properly, either by the therapist or by the patient or
Patients.
something that we have to find out. If, for me, we will find out every 4 weeks. For me, I have to see the result within 4 weeks, a minimal needed. Because if you are not getting result, what you are doing? We have to understand this. Why it is lacking, where it is lacking. We have to find out first, and we have to get it done.
Great. It's really great knowledge, and if we understand normal people to do the right diagnosis and then work on it.
Basically, my motto is always my patients has to understand what is your problem first.
Right.
See, most of the times what happen in villages mostly, if they get any kind of problem, they will go to physician and they will ask tablets. They will not understand what happened to them. They will only think that if we go to doctor, they will give tablet, with the tablet it will subside. See, tablet won't subside your healing.
It will just suppress it for some time.
Suppress, yes, that's what. Any tablet in the world cannot heal your wounds, cannot heal your problems inside your diseases or something. It will suppress it. Your body is amazing. God has created such a way that it will heal by itself. The only nature God given to the body is it heals by itself, unless until if you are not damaging it with some unusual activities. Every time I will tell to everybody only two things: be away from few things, concentrate on your body, keep it hygiene, keep it organized. You are the best.
And that message is really very much important for everyone because unknowingly they are damaging, by drinking or
Yes.
with some bad habits. So, before coming to the last part of this interview, I want to understand what is physical rehabilitation.
See, physical rehabilitation, physiotherapy, both are equal.
Okay.
But physical rehabilitation is a multidisciplinary team. Physical rehabilitation needs nursing care along with the physiotherapy, along with that a physician or a specialist.
Okay.
Okay, for example, if a stroke patient is there, stroke patient was bedridden. So if the stroke patient is bedridden, they need nursing care to feed him, to care him. Okay, physiotherapy to make him physically mobilized, to increase his blood circulation and try to reduce the stiffness and to get back to the life.
Right.
Okay, and coming to the caregivers, they have to clean him, they have to keep him hygiene. Okay, coming to the tablets and medication, again there should be a specialist for him. It may be a neurologist or a physician. Supervision should be there. So physical rehabilitation is always a multidisciplinary team. Physiotherapy is a part of multidisciplinary team.
Thank you so much, Dr. Akhil, for sharing all this information, all your wisdom that will definitely help all of our viewers, our friends. And as you said, in this part of physiotherapy, meditation,
Yes.
exercise,
Yes.
yoga,
Yes.
pranayama, all these things will help. So, before closing, your small message to our audience that how they should be healthy.
Simple. I said you before in a one line. Keep yourself hygiene, very hygiene, and it's not like OCD. Okay, too much hygiene is also not good. Keep it hygiene and keep it organized. Timely food, timely exercise, timely activities, timely work. Everything should be organized way. So this many hours you are working, this many hours you have to exercise, this many hours you have to keep away from this world. You have to meditate, or you have to keep your phones, everything aside. If you are not going to meditate, at least sit silently. If you don't want to meditate, keep yourself free from everything. Everything, once everything, you have to be like blank, something like that. That gives you a lot of energy.
Beautiful. This message is really very much important because Patriji always suggested to do meditation and the food. His message is to have vegetarian diet.
Yes, yes, that's very important.
That is very much important. Thank you. Thank you so much, Dr. Akhil, for coming and sharing all your wisdom.
Thank you.
And I hope we will continue with further great information.
Sure.
Thank you so much.
Thank you so much to you and PMC channel.
Hey friends, I hope you loved this episode and it may definitely help you in your understanding. And if you have any challenges, you can connect physiotherapists nearby. And Dr. Akhil is there. So please like, share, subscribe this channel and share this video. Thank you everyone.